is no surprise that sleep and sleepiness tend to increase with illness. Bacterial, viral, fungal, and protozoan-induced illnesses can have similar effects on the sleep cycle. The first sign of such an infection is usually an increase in sleepiness, accompanied by increased N3 for a day or two and decreased REM for the duration of the infection. In the case of bacterial infections, certain biochemicals are constantly fighting off bacteria in our GI tract, and during illness, their quantities significantly increase. It is likely that extra sleep with more N3 enables the body to devote more resources to healing. The effects of chronic sleep restriction on the immune system are really notable. Chronic sleep restriction decreases host defenses, such as natural killer cells and interleukins. Even loss of sleep on one single night results in a clear reduction of immune responses. The earliest sign of an HIV infection, the agent that causes AIDS, is complaints of fatigue and sleep difficulties. Early stages are accompanied, not surprisingly, by increases in N3. But as the infection worsens, so do these symptoms until, at one point, N3 begins to decrease and the sleep cycles become increasingly disorganized. During advanced stages, there are no recognizable cycles of non-REM and REM. Sleep quality is very poor. N3 is nearly or completely absent, yet the need for sleep increases. Waking hours are defined by fatigue and lethargy. Both acute and chronic stress can cause an increase of several hormones and weaken the immune system. Through these influences, it can disrupt sleep, fragment sleep, and change amounts of some sleep stages. So there are multiple different possible effects of stress on sleep. Some drugs prescribed for non-sleep related problems, especially those that act on the brain, affect the sleep-wake cycle in a variety of ways, from nighttime insomnia to fragmented sleep to daytime sleepiness. This is one of the reasons why the elderly report so many sleep problems compared to younger people. The elderly are more likely to have lengthy maintenance medication lists compared to younger people. Prescription drug culprits to be especially aware of are those used to treat depression, schizophrenia, anxiety, breathing disorders, cardiovascular problems, and those that manipulate histamine, steroid production, or steroid response. You are likely already aware of non-prescription drug culprits that stand out. 3 in particular. They are over-the-counter nasal decongestants, antihistamines, and pain relievers that contain caffeine. But you are less likely to be aware of the effects of smoking. While nicotine increases alertness during the daytime, smokers tend to have more difficulty getting asleep and staying asleep, especially those who smoke an average of a pack or more a day. Quitting smoking results in falling asleep quicker and increases in the quality of sleep, and that applies to both N3 and REM sleep. The effects of pain on sleep are a two-way street. Pain can certainly affect sleep. Sudden or chronic pain often contribute to difficulty getting asleep and experiencing quality sleep, especially in terms of less than 3. On the other hand, sleep debt affects perceptions of pain. Many studies have shown that chronic sleep restriction actually decreases the pain threshold, thus increasing perceptions of pain. Now, exercise can benefit sleep if it raises the body temperature and does not take place too late in the day. It can especially increase total sleep time and the percentage of N3 sleep. Reduced exercise in trained athletes can produce the opposite effects. So, decrease total sleep time and decrease the percentage of N3 sleep. When is exercise too soon before bed? Now, this depends on the individual and may involve some trial and error, right? But here's a good starting place. If you have occasional difficulties getting to sleep at night, you will want to limit it to 4 hours before bedtime or earlier. If you have frequent difficulties getting to sleep at night, you'll want to limit it to 8 hours before bedtime or earlier.